All right. I hope everyone has their popcorn ready for this clinically appraised topic of the hip presented by Josh Gersh and Christian Clemmy. The research article we found is titled The Immediate Effects of Hip Mobilizations with Movement in Patients with Hip Osteoarthritis, a randomized controlled trial. This led us to propose the clinical question, is joint mobilization with movement an effective initial treatment intervention for hip osteoarthritis? As you can see, the PICO components of our question include the population consisting of individuals over the age of 65 with hip OA, the intervention being joint mobilizations with movement, which was compared to a placebo group who received no joint mobilizations. The outcome measures were pain rating, hip mobility, and physical functioning.
So for a little bit of background on hip osteoarthritis itself, it's defined as the progressive loss of hyaline cartilage within the hip joint, sclerosis of the subchondral bone, and the formation of bone spurs at the joint margins. It's classified as a degenerative disease and is commonly associated with pain and disability in more severe cases. It's also a very, very common pathology, especially among the older population, and it's now known that the lifetime risk for symptomatic hip OA is 18.5% for men and 28.6% for women. The study was done knowing that manual therapy is within current clinical practice guidelines for the management of hip OA. However, there's conflicting evidence in the effectiveness of different techniques. One technique that hasn't been investigated in isolation is mobilization with movement. This study is an important step forward in understanding whether mobilization with movement is an effective treatment option for these patients.
During our initial search of the literature, we used both PubMed and CINAHL, but in the end, we ended up using PubMed to find our final article. Some of the search terms we used were hip, pain, strength, weakness, osteoarthritis, surgery, manual therapy. These all gave us some good results related to hip pain and hip injuries. To find our final article, we used the combination of hip osteoarthritis and manual therapy, and this came out to be 47 results once we filtered it to meta-analyses, systematic reviews, randomized control trials, and literature within the past decade. Finally, our article was Immediate Effects of Hip Mobilization with Movement in Patients with Hip Osteoarthritis, a randomized control trial.
This study was ran as a double-blind, randomized, placebo-controlled trial using convenient sampling to gather the participants. They were volunteers from 2 different retirement homes, and the inclusion criteria that had to be met was that they were over the age of 65 and fell within the criteria for hip OA established by the American College of Rheumatology. There ended up being a total of 40 participants for the study that were split randomly into 2 groups, one of which being the mobilization with movement experimental group and the other being the placebo group. In the MWM group, 2 hip mobs were performed using a therapy belt. One was to increase hip flexion and the other to increase internal rotation of the hip, and each were done in sets of 10 with a minute of rest time in between sets. For the placebo group, the same techniques were performed, but there was no force added, and the passive positions of hip flexion and internal rotation were just held for 10 seconds at a time. Each patient also rated their pain on a numeric scale and also performed the tug test, 30-second sit-to-stand, and 40-meter self-paced walk. As far as results, it was found that outcomes were better for patients in the MWM group compared to patients in the placebo group for all of the outcome measures. Pain immediately decreased in 16 out of the 20 patients in the MWM group compared to only 2 in the placebo group. Hip flexion and internal rotation improved by more than the MDCs for almost every patient in the mobilization group, and each of the functional tests, the tug, the self-paced walk, and the 30-second sit-to-stand, had most patients score over the MDCs as well that were from the MWM group. All measures were found to be statistically significant with a p-value less than 0.01. So from this, we can conclude that mobilization with movement is an effective manual therapy technique to improve pain, range of motion, and functional ability in hip OA patients over the age of 65. Here are some photos from the study to show the mobilization techniques.
So the main takeaway from this study is that hip joint mobilizations with movement may be an effective technique used by PTs for treating the specific population of older individuals who present with symptoms of or diagnosis of hip OA. The strengths of this study are the design, which was a randomized control trial, and that it had both primary and secondary outcome measures, which consisted of NPRS pain ratings, hip range of motion measurements, and functional assessments. The weaknesses are that it only consisted of one treatment session of manual therapy and looked at the short-term effects, which may be insufficient when treating a chronic condition such as osteoarthritis. Also, the study only included individuals over the age of 65, so even though this is a population with higher percentages of hip OA, it reduces the generalizability of the results to all individuals with hip osteoarthritis. And the last weakness is that there were no other treatment groups, so the study had a group that received mobilization with movement versus no treatment at all, but does not look at how the technique compares to other forms of physical therapy treatment. So our conclusion about the article is that it was a good study investigating the potential benefits of mobilizations with movement in specific populations, and that it provides useful insight about the transient effects, but further research needs to be done to determine its true efficacy in PT.